Hello, my name is Angela Vaughn, and this is my personal statement video. I believe that this fellowship is an ideal fit for me for several reasons. I think the first has to do with the fact that I am a minority. I actually a triple threat minority, I think. I am a black female, but also my age, I think, puts me into a category of minority because, as we know, a lot of time as we get older, we are kind of set to the side. We're made to believe that we no longer have things to contribute to society and to our communities, and I don't believe that that could be further from the truth. Most importantly, though, I believe that this is an ideal fit because my personal values and how it aligns with me as a developing therapist. Since starting graduate school, it has resonated with me so much. All of the talk of social justice, decolonizing therapy, cross-cultural therapy, cultural competent therapy, the intersectionality of some groups that we kind of forget one part of them and things like that. And so for me, this all aligns with how I want to work as a therapist as I go forward. I have been able to identify just how strongly I feel about advocacy, and it has been on my mind and heart since working in the first domestic violence agency that I was able to work at some years ago, that kind of started this whole journey. So, as I was saying, the population that I want to work with is intimate partner violence. I want to work with women and children. I believe strongly in a quote that I came up with a few years ago, that violence against the mother is violence against the child, and too often we are leaving children uncared for, unhealed, because we are of the belief that once the mother is okay, the child is just going to come along. And I don't believe that that could be further from the truth. Children need their own type of care, whether it be with mom or separately. And so one of my goals eventually is to have a nonprofit that focuses on that access to both the mother and the child. There are some barriers that I do know that exist for the population that I want to work with, and a lot of it is just the complexity of the mental health that they're dealing with in terms of the issues. Sometimes they get lost in translation. It's already enough that they may not have adequate finances, they may not have housing, they may have fear of retaliation, which causes them to not want to continue with care, but also the overlap of anxiety, depression, PTSD, all of these things that need to be addressed, and we cannot separate those things out. We have to learn how to combine all of them and treat the whole of the situation. The way I would like to address this is to make sure that we are looking at having holistic care, that we are addressing each of these issues, combining them, and also, as I said before, dealing with the mother and the child. So my desire is really to make sure that we are having culturally responsive, trauma-informed care for mother and child. This financially would help me so much because I want to continue my education. I want to be able to focus, especially on my internship that's coming up. I'm so excited about it. But I also want to be very responsible academically as I take on this internship and take classes. I want to make sure that my GPA does not fall, because if I decide to go further, maybe to a PhD program, I don't want to have that come back and bite me. So this will help me stay afloat, and it will also contribute to the care that I desire to give to those that will be in my care. So it's not just an investment in me, it's an investment in all the women who are in need. Thank you so much.